Hello, Caldwell community. I'm Casey Cockrell, Superintendent of Caldwell Schools. Thank you for joining us today. We have many things to go over. The first thing I'd like to do is introduce our guest speakers today. We have Ben Rutherford from the high school, Carrie Block, Special Education Coordinator, Jennifer Croucher, Caldwell nurse, Tiffany Speck, Elementary School Principal, Hallie Randalls, Middle School Principal, Kelly Wogemuth, Curriculum Director, Sean Ray from the Health Department, and Kirby Moore from the Health Department. And we'd like to thank all those individuals for coming today. They're going to share a little bit of what's going on with Caldwell Schools and how we're going to start the year. First of all, safety is our number one goal. We want everybody to be safe, students, staff. So you're going to hear a lot about that today. Also, as of right now, our goal is to have students in 5 days a week, all day. We also want to make sure that the educational opportunities are there for all students, no matter where they come from. So we're so excited to have them back. We want to see them. I know they've missed us, we've missed them. So that's kind of our general goal, is to get the students back 5 days a week and to have a safe environment for them to learn. At this time, I'm going to introduce a few individuals to come over and talk about their individual buildings or their individual positions in the district. And first off will be Mr. Rutherford from the high school.
Well, welcome back to the 2020 to 21 academic year. This year is going to be a little different than prior years, but our goal is to remain in class doing face-to-face instruction for as long as we possibly can. As you probably already know, the governor put out several levels. He said yellow, orange, red, and purple. Those are degrees of threat. So the lowest level being yellow, the highest being purple. Our objective is to stay on campus during that yellow and orange threat level. That allows us to remain there 5 days a week in general operation. Now the school will look a little different, as well as some of the protocols and procedures will be a little bit different. So from start to finish, first is transportation. So in the morning, kids are going to get picked up at the buses. Before they get on the buses, though, they'll have their health checked to make sure they're okay to go. Once they get on, they'll be masked with their family members coming to school. Once they get there, breakfast is still available. So the high school folks come in a little bit early, and we got drivers as well. So our procedure might be a little bit different than the elementary school, but we're going to want to keep those numbers really low in the cafeteria space. So Karen's going to be looking at folks when they enter, making sure that we keep that number below about 30 kids in that space. Once we get there, everybody's going to go upstairs into their individual classrooms and have breakfast. Not bad. Once we get our day going, you'll probably also notice when you're in the hallways that there'll be a lot of signage that's going to be different. There'll be socially distancing signs both on the floor as well as on the walls. Additionally, lockers assignments will be a little bit different. In other words, you're not going to have somebody right next to you anymore. It's going to be spread out as much as we possibly can, which means underclassmen will be in the second floor this year. That'll be a little different for us. Having said that, that still allows us to be present on the building, and those are minor. Once we're in the classroom space will also be a little bit different. We'll have barriers that can be constructed, and kids will have masks and shield that'll be at their disposal. Additionally, at the end of each rotation, before every kid leaves, they'll be cleaning their station to be sure the next student group that comes in has a clean station to enter into. The day will go about regularly until about lunchtime. Lunch will be a little different. Given the number of kids in the building, in order to socially distance in the cafeteria space, we wanted to limit the number of kids that could be in there. Consequently, we'll have 3 lunches this year, so that's a big shift. We've gone from 1 lunch last year to 3 lunches this year. That change allows us to operate, not normally, but it allows us to operate in a way that's safe and responsible. We'll still maintain a couple of the things that we did last year, which was our study halls. So when one group's in the lunchroom, one group will be in study hall. And then when one's in the study hall, another group could then also be in a student group. That carries us into the afternoon and then into the end of the day. One side note, restrictions going in and out of the classroom are going to be different this year. In order to make sure all of our bathrooms are clean and sanitized between each rotation, we need to make sure that there aren't folks that are in the hallways constantly going in and out of the bathrooms. At the end of the day, though, there'll be a little bit of a difference in release time. We want our bus riders to get to their lockers and then out to the buses as soon as possible, so they'll get about a 90-second head start. So those that are driving and that are walkers, you guys are going to have to remain in the classroom a little bit longer. That allows us to space out one another so that folks can get on the bus and get moving. Be sure to be respectful of one another when you're on campus. I know it's going to be a little bit different, but we're going to make the best of it. Our next talker is going to be Carrie Block. She's our special ed director.
Thank you, Mr. Rutherford. As he said, I am Carrie Block. I'm the Director of Special Education for Caldwell Schools. I've had parents ask about what special education will look like this year at Caldwell. Basically, regardless of any situation, we're committed to child find here at Caldwell. So what that means is if a parent or an administrator or a teacher suspects that a child has a disability, we will convene an IEP team meeting and begin the process of multi-tiered systems of support. We'll take a look at the whole child, academic needs, emotional or physical needs, and put together a plan to meet their unique needs in terms of interventions. So in having these meetings, if we decide that an evaluation is warranted, we will complete a multi-factored evaluation. So the evaluation process might look a little different, but at Caldwell we are completing evaluations and following IDEA. So that brings me to my next topic, evaluations, IEP meetings. How will those look different? So we will continue to have IEP meetings. Federal law, we will do what's best for kids and families. We'll have some options. Parents can opt to meet face-to-face or over the phone or virtually. We understand that not everyone has access to the internet or has a computer and can manipulate Zoom. So you can have a face-to-face meeting, but what will happen is upon arrival, you will text a number and my secretary will let you know when it's okay to come in, and you'll come in the back door next to the conference room. You will need to have a mask on, and you will be limited to this area only. You will not be permitted out into the building or in any other part of the office. If you are unable to wear a mask due to health reasons, let us know prior to the meeting. We have also purchased new furniture for our conference room that is able to be sanitized in between meetings, no cloth materials. So we just want to keep everybody in the community as safe as possible. Finally, I have had some questions from parents who have children that are currently on IEPs or have 504s. If your child is unable to wear a mask due to a disability that is documented within a current IEP or 504, as a district, we are not requiring that you get additional documentation from a physician exempting him or her. Obviously, you have the IEP and 504 in place, and it does document that your child has a disability, and we will honor that. But we would like for you to call the school ahead of time and speak with my secretary, Sherry Jones, and let her know that you will not be sending your child to school with a mask, so we will know ahead of time and can plan accordingly, because we just want to prevent any unnecessary confusion. So we are asking that you call us before school starts in September and let us know that your child will not be able to wear a mask due to his or her disability. And if you have any other questions, you can call me at the elementary school, 732-4614. Next is our school nurse, Jennifer Croucher.
Good morning. I am Jennifer Croucher. I'm the school nurse for Caldwell Schools, and I'm going to go over some health and safety information for our students. Beginning with the morning, we are asking that the parents check their students before coming to school. At this time, we are not checking temperatures when they come to school. We are going to ask the parents to check the students when they get up in the morning, check to see how they're feeling, check to see if they have a temperature, and That's how we're doing it at this time. That could change. All students in grades pre-K to 12 must wear a mask or a shield per the governor's orders. This includes on the bus. Each student will be provided with a mask and a shield, and the masks will be sent home at the end of the day, and we ask that the parents do wash those daily. The shields will be left at the school and can be sanitized. They will be sanitized and ready for use the next day. In the event that they may not have one, we will have extra masks on hand for students that don't have one for that day. We will go over some very basic health and safety tips for our students, things such as just hand washing, the proper way to wash your hands, when to wash your hands, and stressing the importance of how that's protecting them and the other students. So we will have demonstrations for the students. The teachers will, be able to help the students with that each day. We're asking that you pack a water bottle for the students. For health reasons, the fountains will be closed at this time. We will have refilling stations where they can refill their water bottle, but at this time we're asking that you send a water bottle for your students. All students will be asked to sanitize their hands before they board the bus, and I do want to mention that we will have hand sanitizer throughout the building. All classrooms will have it. We will have plenty of hand sanitizer at various stations throughout the school, so they will be asked to sanitize their hands frequently. The best thing for them to do is wash with soap and water, but if that's not available, then the next best thing for them to do is to sanitize their hands with hand sanitizer, and we will have that for them. First aid containers will be available in each classroom, so that way we are trying to minimize the flow of traffic in and out of the nurse's office. This year particularly, we are going to try to focus on the COVID symptoms. I mean, that's not saying that your student can't come to the nurse's office, but the teachers will be provided with general first aid kits, Band-Aids, things like that, so that the students will be able to be taken care of a little bit more in the classroom versus having to come in and out of the office, which will minimize the traffic. Isolation rooms. If a student, I'm going to kind of back up a second. We do have a COVID screening. If a student would come into the office, they'll be, if they come in, they generally just say they don't feel good, that kind of thing. So I will assess them and looking for things such as fever, cough, congestion, fatigue, muscle or body aches, diarrhea, headache, sore throat, shortness of breath, nausea or vomiting, or a recent loss of smell or taste. Our protocol already is that if a student has a temperature of over 100 or greater, that they will be I will ask for the parents to come and pick them up. Then if they answered yes to one of those questions and nothing else, that child will be sent home, and they will be they cannot be sent back until they are fever free without fever reducing medication before they're sent back to school, and that's already our policy. So I do believe that the parents are aware of that. Secondly, they will be asked if they have had close contact within 6 feet of an infected person for at least 15 minutes with a person with confirmed COVID-19 in the last 14 days. We'll ask if they have traveled to or lived in an area where local, tribal, territorial, or state health departments are reporting large number of COVID-19 cases. We'll ask if within the past 14 days, has a public health or medical profession told you to self-monitor, self-isolate, or self-quarantine because of the concerns about the COVID-19 infection? If any of those second set of questions they answer yes to, then they will be sent home, and they will have to have a physician sign off clearing them to come back to school. The isolation room that we will have at school, we will have designated areas. We'll have the regular nurse's office where students can come in. If I see that a student needs to be isolated and sent home, they will go to the isolation area, and the nurse's office will be properly cleaned. In the isolation area, they will be kept from other students. We will have a staff member that can sit with them, and then they will stay there until someone can pick them up. I can't stress the importance enough of providing the school with enough phone numbers for us to reach you, especially this year. I know that people work. I know that, you know, things come up, but it's so important for you to give us correct phone numbers. If those change throughout the year, please make us aware of that. Because, you know, the whole thing is we don't want students sitting there for an extended length of time. So I just ask that you, if you have any questions, this is how things are right now. As you know, things can change very quickly. So if you have any questions, you can always call me at the school. Carrie gave you the number. It's 732-4614. I'll be happy to talk to you, especially if there's situations, you know, different situations. So don't hesitate to call. If you want to check on your student, we always encourage you to call. So that's all I have to say. And next will be Dr. Hallie Randalls, and she is our middle school elementary principal.
Hello, we are so excited about the upcoming school year. Yes, things will be different, but it's been a long time since we've seen you, and all of us have been talking about we are so ready to get back to school. We'll talk about some things that were already covered by Mr. Rutherford, the principal at the high school. First, when we talk about transportation, all students will sanitize their hands as they get onto the bus. All students are required to wear a mask or shield, but there's exemptions for those who have documented medical reasons. Students will have assigned seats. They'll sit by families and also social distance. The next plan is when you actually arrive to the school, you will be going straight to your classroom, and you will have the ability to have breakfast right there in the classroom, just like we did last year. Staff will notice if any student has any symptoms, and with that, she will do an assessment at that time. Let's talk about learning, because that's the second most important thing. First of all, students who would prefer to be educated at home this year, we do have the Caldwell Academy. There's no cost. You get to borrow one of the Chromebooks for the year. If you're interested, please call Mrs. Yantz at 740-732-5637. It's a wonderful opportunity. Next, students will be using Schoology, which is the technology platform that we will be using. And so that whether they're in school or whether they're in home, they're using the same resources. Our K-3 students will be self-contained. That means they'll just have one academic teacher. In grades 4 and 5, students will have 2 academic teachers, and the teacher will actually move instead of the students. Then in grade 6, they'll have 3 academic teachers, and again, the teachers will be moving, not the students. And for grades 7 through 12, students will change classes, but they will sanitize in between each period. Within the classroom, there will be partitions. So some of them will be larger partitions, more at the primary level, and then at the middle school level, they will have partitions on their desks, so a 3-sided partition. And they'll be disinfected each evening so that when they arrive the next day, it's in good shape. The library also will be open. Students will be able to check out school books and books of their own interest. And our focus this year really is on the completion of schoolwork instead of attendance, because we do want kids that are not feeling well to go ahead and stay home so that we can stay open as long as possible. Thank you, and Mrs. Tiffany Speck, the primary principal, will be speaking next.
Hi everybody. I'm going to start from where Hallie left off and talk about lunches and recess. Lunches will be done similar but different. We're going to limit the number of students at the tables. There will be less at each table, about 8 to a table. They will be staying by their home rooms. They will sanitize their hands or wash them prior to coming in to eat and also on their way to recess. Recess will be done by classes, so they'll stay with their homeroom class. As Mrs. Croucher said, the water fountains are closed, and we ask that you send a water bottle the first day. We are blessed that the United Way is going to donate a water bottle for each student. So we will have those to give to the students on the first day of school, and we'll make sure we put their names on those. For this year, at this time, there is going to be no visitors or volunteers allowed in the building. If you need to pick your child up, drop them off, or drop something off for them, you'll need to park out front and call the office. Again, the number is 740-732-4614, and the secretaries will give you instructions on what to do. Dismissal this year is going to be similar to last year. We have made plans to spread the students out more in the holding area. Parents will still drive their cars down around back and come up around. The difference will be that the parents are going to keep the cards this year. One side will list all the students in your family, and the back side will list all the adults that are allowed to pick those students up. You will need to have that card and your ID held up to show the adult that will be at the colored cone, and they will check it. They will not touch the card, they will not touch your ID, you'll just have to show it to them so they can read it. Parents are responsible for making sure that those cards are up to date, and that you keep track of those cards so that nobody else gets a hold of those. And if you have questions about any of that stuff or anything else in the school, please call us. Dr. Randalls and I are both available every day. We are busy putting signage up in our buildings to make this safe for your kids, and we are trying to make it as normal as possible for everybody, given what the circumstances are.
Well, thank you to Caldwell Schools for inviting Kirby and myself. If you don't know, my name is Sean Ray. I'm the Health Commissioner with the Noble County Health Department. And first, let me kind of just kick off the situation a little bit. We're currently in Noble County in the United States and the world probably experiencing the greatest health threat that we've had in 100 years. In fact, the Noble County Health Department was born out of the Spanish flu epidemic in 1918. I'm real pleased to acknowledge the community's previous efforts that we've had in the last 8 or 9 months in our work to prevent the spread of COVID-19. And as a result, Noble County is currently in the bottom of Ohio on the number of cases and the incidence rate of community spread. That is a result of everyone's efforts to this date. We have been involved with Caldwell Schools on multiple occasions in the last few months to work with them for a return to school work plan where we ensure that Noble County stays at the bottom of the state. And that's all of our goals. Caldwell School District's never faced such a drastic change in the way to educate their children. I will say, though, I have witnessed the administration do a lot of extensive planning, collaboration, and in their effort to bring your children back to school safely. The Noble County Health Department's been a part of that collaboration. We're happy to have been a part of it, and we truly believe that the administration here truly fully embraces providing your children comprehensive and safe education. The other part I want to emphasize, and I think it's important for everyone in the room to hear too, is the health department's mission is not to tell the education experts how to educate. We are not the education experts. Our mission is to help the administration and the community in planning and implementing a safe environment that prevents the spread of COVID-19 in the school. And I think everything that you've heard today, there's been a huge amount of effort and thought put into that, and there will be a lot of work when school comes into session. Again, the whole mission is to keep your children safe and keep the families safe so the children don't take the disease back to them, and for Noble County to stay in the bottom of the state in a number of levels. I do want to share A lot of this planning that you've heard has really been based out of state and federal guidance based on 5 principles. One is for the families and the schools to diligently assess the symptoms of COVID for the children and staff as they come to work. Always to be washing and sanitizing hands to help spread the disease, help prevent the spread of disease. To thoroughly clean and sanitize the school environment so that we limit the spread on shared surfaces, to practice social distancing, and to implement the face coverings policy, which again is a huge effort and now required by the state of Ohio to prevent the spreading of disease. In taking those 5 principles, part of what you've heard today are efforts around things like assigned seating, cohorting of classrooms, eating in classrooms or eating in classroom cohorts in the cafeteria at the recess. These extra efforts are to limit the number of children and staff that would be exposed to a particular case, and by limiting the numbers that you're in contact with, that also means that should a student or staff member become positive, it also limits the number of children or staff that needs to be kept home. Because again, it's all about safe and education. On that, I'm gonna let Kirby cover a little bit.
Good morning. Thanks for having us. It's a great opportunity to collaborate with the schools and with Caldwell Schools. They've invited us to meetings, and they've certainly done everything they've needed to do to make this safe. I looked at the signage when I came in. Signage is key. People may not read a lot of stuff for pleasure, but these things are part of our community pattern now, that people look at signs to make sure what the rules might be or what they can do or can't do at certain facilities. I just appreciate Caldwell going through the efforts to do the things they need to do to keep people aware of the situation, because as Sean said, it's all about the 5 basic principles: continuing to wash your hands, face coverings. Talked to our epidemiologist the other day, and she spoke with her brother, who was not really sure about COVID and not really sure about all the situations. After a 2-hour conversation with him, he asked one question: what is it that I can do that can keep people from getting this disease or infection? And she said, stay away from people. Now, that's not easy for the schools to do. However, it's, as Sean said, encouraged that people stay in their groups. The less people that are exposed, the better. Our nurses at the health department go through the challenge of contact tracing, meaning they have to call the people, talk to the people, and find out who is in contact with whom, and go from each situation. So the less people that are in that category, the better. So those are things that make it easier if somebody does become sick, that there's a smaller group of people involved. So that's kind of great to know that they're not moving classes and that they're going to be switching teachers instead. The teachers are kind of sacrificing, as they do often, for the students to keep them safe. So as Sean said, we're very comfortable with what the schools have done here to keep in accordance with the rules and guidelines, because it's a fluid situation. If, as you probably watched on TV, things change every day, and we've been changing every day since March, as you all have. So it's an opportunity for your students to get back to school, to learn from the educators that know what they're doing. Certainly the health department, we can educate on public health, but we certainly can't educate your children in the things that they need. So we're thankful for them and what they've done and the efforts that they've given, and appreciate the opportunity to be here. Also want to mention not only the challenge with learning, but the challenge of mental health and some of the things that we have to deal with at the health department, with some of the challenges that we have and have the opportunity to deal with too. So we've always encouraged people to look into mental health, as well as we talk about the public health side of things. So that's something that may need to be addressed as well and discussed. So I have nothing else to add. just appreciate the efforts. And we're available at the health department for questions, of course, 5 days a week. So we hope that the schools are taking care of these things. And I'm glad as a food inspector that they've taken care of the things that they need to take care of in their cafeteria and keeping the children apart and away from one another.
Let me want to add another bit to help the school nurse on a totally different subject, but it plays in the COVID as well. In some ways, the experts are a little fearful of the flu coming this fall because we had during last year a little more virulent strains of that, and people were sicker with the flu. But also a requirement in the schools is that by a certain age level, all children are required to have certain vaccinations. And so Mrs. Croucher, the school nurse, is tasked with the job of ensuring your children has documented that for them by certain points. I'll just plant the seed right now that you're not going back to school till I think September 8th. Let's do that before September 8th and not make Jennifer have to hound you to get that accomplished. And the reason I bring that up is that a lot of these childhood vaccinations that you're getting vaccinated for are, a lot of them are respiratory type of diseases, just like COVID-19. We have since found in the few months that we've been experiencing COVID that you can actually have the flu and COVID at the same time and some of these other diseases. So the more we do to prevent you getting ill from the other ones, the greater your chance of coming through COVID in a better fashion to begin with. It just takes one more thing off of the plate to make you a safer child. So, is there any questions you want us to answer or anything before we? Again, thanks for the opportunity. Thanks for the collaboration with the school. And I know that we'll be talking a lot in the coming months. So, thank you.
And I'd like to end with a few highlights, maybe going over some things that some of the other individuals have already gone over, but very important to our school and the ability to keep it open and keep our students and staff safe. A couple of questions we've had, I'll answer those from the community members and some parents. Talking about level 1, which is yellow, level 2 is orange, depending on what the county is. That is, we're going to go full-time, 100% of the students 5 days a week. If we become a level 3 or level 4, which I certainly hope not, that's a red or purple, we will do the fully online and the remote learning for students. So we hope we don't have to get to that point, but we do have a plan in case we do. A couple of things for parents and guardians. All students in grades pre-K through 12 must wear a mask or shield, except for documented reasons. And we have provided for each student and staff member a shield and a Caldwell mask that everybody will be getting. We encourage students and parents put your names on those. We're going to keep the masks at school. They'll get sanitized every night. And the mask, we encourage you to take those home and bring those back every day. Also, students, make sure you wash your hands thoroughly. Please, parents, guardians, take your children's temperature, keep your child home. If someone in the home has tested positive for COVID or has the following symptoms: fever of 100 degrees or above, cough, if they're sleepy, the chills, having trouble breathing, body aches, sore throat, runny nose, nausea, vomiting, diarrhea, loss of taste or smell. We talked about the United Way providing water bottles for us. So we'll have water bottle filling stations. The water fountains, unfortunately, will be closed, but we will have filling stations in both buildings. I'd like to thank you to the Girl Scouts. They provide lanyards for us so students can wear their lanyards, and when they're eating lunch or something, they can fasten their mask to the lanyard so they don't sit on the table and get dirty that way. So thank you to the Girl Scouts for that. We'll be providing those lanyards to students. Students will be taught skills in hand washing, physical distancing, appropriate use of face masks, cough and sneeze etiquette, and remember to stay home if you are sick or displaying some of the symptoms. Our custodians and maintenance crew, they've done a great job this summer, and they've had proper training on COVID-19 transmission and disinfection, so they're continuing to keep our buildings clean and ready for students. The signage that we talked about, you're going to see those throughout the buildings. We have nice Caldwell signs that will be everywhere. We're going to clean the high contact areas, bathrooms, doorknobs throughout the day. And at the end of the day, the thorough cleaning of the building will be done. Let's see, hand sanitizer will be available on all buses, at the entrance of buildings and each classroom. Disinfectants are also located in each classroom. Isolation room for those students and staff with fevers over 100 or have symptoms of COVID-19. And those isolation rooms will be monitored by school personnel, and students must be picked up by the parents or guardians if they have those. Ill students and staff may return if no fever 100 or above for 24 hours without using fever-reducing medication. A parent must transport the student to school for a check by the nurse. Let's see. Students traveling to a location with high rates of COVID must follow the Noble County Health Department guidelines regarding quarantining. The school will provide instructions online if quarantining. Students will not be counted absent when using online instruction. The Noble County Health Department determines the guidelines for returning after a quarantine. Mental health, I know that's a big issue. We have Allwell in the school district, full-time person, Ms. Barnhart, will be here to help with mental health issues. Plus we have 2 school counselors, one at the high school and one at the elementary school, that can help students and help families if they have some of those issues. Also, I just really want to thank the staff, the administration, the health department, the community, parents, students. You have given us lots to think about, lots of good questions. We certainly do not have all the answers. As you think of things, I encourage you to talk to your school administrators, talk to myself. We will be glad to answer or try to find the answer. And some things we just don't know about yet. So this is a day by day, a fluid situation. We're very excited to have the students back. So that's our main goal, is the safety and getting our students back. And we can't wait to see you. And for all of us here at Caldwell, we'd like to thank you for being a Caldwell community member, and go Redskins.